Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. Today, we're going to talk about polycystic ovary syndrome, known as PCOS, and the use of oral contraceptives, also known as birth control pills. Now, first, there are many good reasons to use birth control pills, and there are also some bad ones. In other words, there are some potential significant side effects. To understand, first, let's talk about what is a birth control pill. When I say birth control pill, I'm going to say that that also includes other comparable ways of delivering this hormone, and that is through rings that are placed intravaginally or patches that are placed on the skin. They fall under the umbrella of hormonal contraceptives. In this particular talk, I'm not going to specifically address the hormonal IUDs or the implantables. We're going to talk about them separately because they only incorporate a progestin, whereas the other hormonal modalities I just mentioned, which are keynoted by the birth control pills, oral contraceptives, combine an estrogen product with a progestogen or progestin product. So let's talk about what are birth control pills. They are chemicals, they're not human hormones. That's really important because they're often talked about as if they're identical to human made ovarian hormones, but they are not. Now, there are some new ones on the market. I'm going to talk about the ones that are the dominant ones, and we'll talk about some of the newer ones that are not in very great use yet another time. So, the estrogen that's in the birth control pill is called ethinyl estradiol. Now, the estrogen that's made by the ovaries is 17 beta estradiol. They sound so similar, ethinyl estradiol, 17 beta estradiol, but they're actually different. It doesn't take much to make a molecule that's a hormone into something different. And when you make it into something different, it's going to behave somewhat differently in the human body. On top of that, when this ethinyl estradiol gets into the bloodstream, it gets in as a different form of estrogen called estrone. Now, estrogen, there are three, or maybe there's more, but predominantly three different types of receptors in the human body for estrogens. So a receptor is, like it sounds, the receptacle for the hormone. So here is the receptor, here is the hormone, it fits in, it like turns it on, and then things happen in the cell. So you can put a phony baloney kind of a mimic of a human hormone into a receptor, and it doesn't quite fit. It's a little different, but it kind of gets in there. But it can have either a pro or a con effect, like it turns on the switch or off the switch, it keeps it off, or it may have something in between. So it can affect the hormone receptors quite differently. And when you talk about estrone, the estrogen that gets into the body from birth control pills, it works predominantly on just one of the three types of estrogen receptors, whereas estradiol made in the ovary works on all the different estrogen receptors in a balanced way. That leads to a different effect in the body. And that's very important because birth control pills are actually designed by their very nature and their origins as contraceptives to make it so that women are no longer fertile. It changes their hormones in the body to prevent pregnancy. Well, as it happens, being fertile is a vital sign of being healthy. And women with PCOS, one of their big problems is infertility. And that is not just a limited thing in women with PCOS, because not only do they have infertility, but they have total body metabolic problems. And birth control pills, the good and the bad, are because of the pro and negative effects on all of these different issues. So let's talk a little bit about what are some of the good effects of birth control pills. Oh, let me just first mention that the progestin that's in birth control pills come in a variety of different, we'll call them flavors, different types of molecules, which have different effects. They're not progesterone. the natural hormone made by the ovary. They're not progesterone. I repeat, they're progestins. That's a made up word for an endocrine disruptor, a chemical that somewhat mimics progesterone, but is not progesterone and has very different effects. And the different progestins that are in different birth control pills can have either positive or actually negative effects on women with PCOS because some of them actually have androgenic effects, like the one called levonorgestrel that's in some birth control pills that are actually quite popular. That actually has some androgenic effects. In other words, it can actually bind to testosterone receptors and turn on the receptor as if it really were testosterone, which it isn't, but it can mimic testosterone, which is certainly not what any woman with PCOS wants because they have an elevated amount of testosterone typically. So, other birth control pills have drospirenine. That's a different progestin that can act as a blocker to testosterone in the receptor and has some of the beneficial effects that women with PCOS are desiring. But all birth control pills, to a significant degree, have an increased risk for creating blood clots. Fortunately, young women as a group have a low incidence of having blood clots, but women with PCOS as a group, because they are in a pro inflammatory state, have an increased risk of getting a blood clot. And there are studies published that show that the two together, adding birth control pills to women with PCOS, it's an additive effect, increasing the risk of developing a blood clot compared to just one or the other. And in women with PCOS, the last thing you want is to increase the risk of a blood clot because blood clots can be, of course, very unpleasant. They can lodge in a vein in a leg, causing pain and swelling. But if that blood clot that's formed in the legs breaks off and travels up into the lungs, it can cause what's called a pulmonary embolism, block the ability of the lungs to oxygenate the blood, and can be fatal even. The risk is not absolutely high, but it's statistically increased when you add birth control pills into the body of women with PCOS. So remember, the absolute risk, the chance of getting a blood clot, especially a fatal one, is low, but you are definitely increasing the risk when you add birth control pills into women with PCOS. So that is a negative. What is a positive? We want to balance it. If you're going to decide you're going to use it, not use it. So what's a positive? Well, I already mentioned women with PCOS tend to have high levels of androgens like testosterone or the adrenal androgen DHEAS. The dominant one is elevated testosterone. Well, it turns out that birth control pills can lower testosterone, which is a very big advantage for women with PCOS because testosterone is driving many of the skin manifestations that really lower quality of life. For example, that jawline cystic acne that we call hormonal acne, which is so hard to treat. And often only drugs like Accutane will treat it. And then it actually has a significant failure rate when it's used in women with PCOS in terms of recurrences. So it's a very difficult to treat. Now, all women with the use of birth control pills don't have resolution of their acne, but many women do see significant improvements because of the reduction of the testosterone. Additionally, women with PCOS often have what's called hirsutism or excessive facial hair or other areas of body hair, which is very distressing. What woman wants to get up and shave her face every morning and have 5 o'clock stubble? So that's very distressing as a symptom. And birth control pills can help to reduce new development of hirsutism. As well, many women with PCOS have what's called androgenic alopecia, the thinning of the hair, what we would call female version of male pattern baldness. Well, by lowering the androgens, by lowering the testosterone, that too can be somewhat improved. So those are not insignificant issues. And another one is that having high levels of testosterone can further drive some of the inflammatory processes that women with PCOS are suffering from. So there is some ability to counteract some of that inflammatory process due to the high levels of testosterone. So what else? Well, Women with PCOS tend to have irregular cycles. That's part of the definition. Well, when you take birth control pills, they do not regulate your periods. They don't give you normal periods. They shut down the ovaries and replace the ovarian hormones, which are dysregulated in women with PCOS, with these chemical hormones. They're not human hormones that are in birth control pills. And they give regular bleeding. So it's not regulating the menstrual cycle. You're not fixing the woman's hormonal production at all. You're shutting it down, but it gives the illusion of being normal. But you do get, in most cases, regular bleeding episodes that look like their normal periods. So it gives the illusion of fixing something, but you're actually just shutting things down. So there's a little bit of smoke and mirrors here, but it's still not a bad thing to have regular bleeds as opposed to random. Women with PCOS, if they have unregulated hormones and are not given progesterone to essentially clean out the uterine lining, they can go many, many months with inflammation and no periods. That increases, even at a young age, the risk of developing uterine or what we call endometrial adenocarcinoma, cancer of the lining of the uterus, and going on birth control pills can help reduce that risk. So, absolutely, there are benefits to birth control pills. Well, what about the negatives? I already mentioned one, which is increased risk of blood clots. What else? Well, it turns out that birth control pills, not being real human hormones, they're technically endocrine disruptors. They're not human hormones. They can alter the gut microbiome. And that's a very big deal because the microbial life forms in our gut are really key to making us healthy, to maintaining healthy, happy brains and vascular system and controlling the immune system and inflammation. So women with PCOS who go on birth control pills, they are more likely to develop impaired gut barrier, dysbiosis of the gut microbial population or abnormal gut microbiomes, and what we call leaky gut. When this happens, the abnormal microbial life forms can actually cross into the body itself, triggering more inflammation and increasing the risk of certain types of autoimmune diseases, particularly Hashimoto's, which is autoimmune thyroid. We also know that it increases the risk of Crohn's disease, which is an autoimmune condition of the GI tract. So that's not good. And as well, it can trigger more inflammation to counteract any benefit of reduced inflammation by lowering testosterone because of the gut dysbiosis and the leaky gut. So that is all a problem. As well, birth control pills going into the body as estrone only acts on the alpha receptor, which is the receptor on innate immune cells. They're the immune cells that actually are the first line of defense. So I call them like the attack animals of the immune system. And they can be upregulated, also promoting more inflammation in the body. We know that women, especially young women on birth control pills, have a higher risk of depression, and even some data suggests higher rates of suicide. So giving young women birth control pills may increase their mood problems, which are already a problem in many women with PCOS. What else? There's now published data that young women in their teens who go on birth control pills are more likely to have cardiovascular events, cardiovascular disease later in their life, increasing the risk of things like heart attacks and strokes above what it would be had they not gone on the birth control pills in their teen years. Women with PCOS already have a higher risk of cardiovascular disease and vascular problems. So that is not good. Birth control pills lower the production of a very important gas called nitric oxide, which is an antioxidant gas that keeps arteries healthy and flexible. And that is lowered in users of birth control pills. Women with PCOS already have deficiencies of nitric oxide and vascular problems, promoting more hypertension at a younger age. This is aggravating that potential problem. So you can see that there are some really significant problems. And then there is some data as well that women who go on birth control pills when they're quite young, they do not optimize the development of their bones. They may be impaired. But women with PCOS don't necessarily develop the best bones anyway because of their hormonal imbalances. We have no long term data on that particular subject. It's just one of concern. So you can see it's complex. If you have severe acne, if you have hirsutism, androgenic alopecia, irregular cycles, and you have PCOS, shouldn't you go on birth control pills? Well, maybe you should for a little while, or maybe what you could do is try other modalities to create a similar benefit without the negatives of birth control pills. For example, there are certain supplements that can help the ovaries to do better at making estrogen. You can even give, like I can. As a physician, I can prescribe estrogen to women who are not making it enough. I can prescribe progesterone, human bioidentical progesterone, not the chemicals that are in birth control pills. I can give hormones that women need in the bioidentical human form so that they can have them to help their bodies to heal. And then I can take them away and let them hopefully make their own at a better level. As well, there are other nutraceuticals and lifestyle, like, for example, different types of fasting, doing gut healing resets where you eat certain foods, go on certain supplements to try to help the gut microbiome to be healthier and better. We can work with the circadian rhythm. We know, for example, when women who with PCOS eat 2/3 of their food for the day for breakfast, an early meal, and then 1/3 for a late lunch or early dinner, depending on how you want to think of it. In just 1 month, their testosterone level and insulin level dropped by 50% or more. So, lifestyle can be the ticket for women with PCOS to actually reduce their testosterone to restore natural cycles without using birth control pills with their attendant potential harms. Every pharmaceutical, which birth control pills are one of them, have good and bad parts. That's why it's important to know this, because that's what we call in the medical world informed consent. Knowing the good, knowing the bad, weighing the risks, the pros and cons, so that you can decide for yourself. Do you want to go on birth control pills, understanding the potential risks? Would you prefer to go on a lifestyle regimen? Do you want to try both for a short period of time and maybe go off the birth control pills? Birth control pills can definitely improve symptoms. They don't improve your ovarian function. They can potentially have negative effects on your cardiovascular system, your musculoskeletal system, your neurological system. They're not without their negatives, but they're also not without their positives. Think it through and decide what's best for you. Looking forward to seeing you again soon. Take care.